Let's talk about how hormonal birth control, the pill, works. This comes up for me almost every day when I'm talking to patients, since I see a lot of people that are interested in learning about their options for fertility preservation, whether it be egg freezing or embryo freezing. I also see patients for fertility checkups. And a lot of people have been on the pill for years, sometimes even decades. A lot of times I hear the story of being put on the pill in your teens because of irregular, heavy, or problematic cycles, or needing it for contraception. I am constantly reassuring people that it is not bad or dangerous that they've been on the pill for years. What the pill is actually doing is, because of the small amounts of estrogen that it contains, it's actually able to fool your brain, your pituitary gland, into thinking that the ovaries are already functioning and making the necessary estrogen because of a mature follicle that's being ovulated. And so that FSH, follicle stimulating hormone signal, shuts off. And that's what the pill is effectively doing. It's preventing your brain from selecting a dominant follicle to ovulate. And in doing so, you're just kind of stuck as if you're always at day 2 or day 3 of your period. This is why I, as a fertility specialist, often will use the pill for convenience sake when a patient has work travel or wants to defer their cycle without having to wait an entire month. A common concern or question I get asked is it bad or dangerous that I haven't been ovulating all these years? Or if they're using the pill to skip their period because they're just not taking the 7 days of placebo, or, taking a break from the pill for a week to have a withdrawal bleed, is that bad? Is the lining of my uterus stagnant, so to speak? The answer is no to both questions. It is not bad or dangerous. Your ovary has these waves of recruited follicles that are being recruited and going away regardless of whether or not you're ovulating. So unfortunately, the pill does not serve as a way to stockpile your eggs for future use. Otherwise, we would never need things like egg freezing. But it's not bad that you're not releasing an egg. It doesn't mean that the ovaries are collecting dust, so to speak, or going to forget how to ovulate. It can take a little bit of time, sometimes 3 months or so, to get back into a normal ovulatory pattern after coming off of the pill. But that's just your brain waking up and smelling the coffee, or the lack of estrogen rather, and then it starts to function. And if it takes longer than 6 months, that's time to see a doctor, because there may be an underlying issue like PCOS that you didn't know about, or hypothalamic amenorrhea, which you didn't know about. But that's not necessarily a bad thing, and the pill may have been helping you balance out some of the hormonal imbalances that can happen with problems like PCOS. So it's not bad if you don't get a withdrawal bleed. The pill is often just keeping your lining thin, and there's nothing to really shed. So you're keeping everything in balance. This might be confusing to some people, especially those with PCOS, who may not get periods indefinitely without inducing withdrawal bleed, or they may skip periods for months and months at a time. That can actually be dangerous, because you can have this unhealthy imbalance where your lining is only exposed to estrogen and it's chronically built up, and there's never any exposure to progesterone, because progesterone only comes when you're ovulating. And you really need a fine balance between estrogen and progesterone when it comes to your lining. With the pill, you're taking usually small doses of estrogen and progesterone. So the fact that you're not getting a period, it's still not allowing you to build up this unhealthy lining that can turn into precancerous or cancerous cells of the uterus. So it's really not a concern. So my message here is to reassure anyone that's been on the pill for a long time: if you're using it and you're happy with it as a form of contraception, if it's helped you to have regular periods or avoid pesky irregular bleeding or heavy periods or painful periods, it's fine to keep going with it. And it is a reversible form of contraception. When you stop the pill, it will restore your fertility. And if there's an underlying issue, it's not because you were on the pill. The pill may actually be helping you to treat some of those issues.